Thank you to everyone in South Dakota for staying diligent and for being informed. COVID.sd.gov is the website where a lot of people have been visiting to get information on the virus and how it's impacting South Dakota. We've had over 30,000 visits to that website in the last 24 to 36 hours. So people are utilizing it, and we appreciate them staying informed and diligent on what they can do to protect them and their families and make wise decisions. My team in the Department of Health have been working and preparing for COVID-19 since January. We have an interagency task force that has been managing the day-to-day activities and state agency planning as well going forward. We've been in constant communication with healthcare providers, with nursing home providers, local leaders. We did brief the legislators not too long ago and answered their questions as well. As we said yesterday, we tested 5 individuals that came back with preliminary positive cases of COVID-19. We do have 3 more positive cases today, and so they are all male. They are all resting at home. I'll give you the counties that they're from and their age ranges. The first male is from Minnehaha County, ages 40 to 49 group. One is from Minnehaha County, so we have 2 from there that is in the 50 to 59 year age group, and then one from Bon Homme, which is from the age group of 60 to 69. Our total numbers of COVID cases is we've had 27 negative tests come back. We've had 8 now positive tests, and we have 11 tests that are still pending at the State Public Health Lab. Additional testing will be done. We expect there to be more positives as we go into the future, and I want to remind everybody that 80% of those who do get this virus will have no symptoms whatsoever or very mild symptoms. I do want to caution those who may be older, that may have pre-existing health conditions or compromised immune systems, that they should take and make wise decisions. They should stay home. They should wash their hands. If they aren't feeling well, they should call their healthcare provider. Please do not go into the clinic or to the hospital. Call your healthcare provider and they will walk through the steps for you on what the best decisions are. Communicating is continuing to go on with nursing homes, with tribes, IHS facilities, and with our schools. We're working very closely with the CDC about our resource needs and providing guidance to those that are making decisions about where to go and events to be held. I just want to remind the general public across the state of South Dakota that this is something that we have been prepared for, that we are coordinating well with your local leaders and healthcare providers on, that they need to please, if they would like more information, go to our website, which is covid.sd.gov, or call the 800 number that they can find on that website as well. And we will continue to take questions and answer and get information out there as well. But I also want to remind those that may be vulnerable, that are older or have pre-existing conditions or compromised immune systems, to please stay home. That is the biggest impact that we can have right now to stop any kind of exposure to those who may have the virus and keep people safe. With that, I'll open it up to questions.
Do we know if any of these cases were travel-related that are new today? Do we know if any of the cases are travel-related that are new today, or whether there's possibility that some of these were circling within Minnehaha County?
This is Kim Alsom-Reisen with the Department of Health. We do know that 2 of the cases had travel history in the last week. We do not know the travel history of the 3rd person, so that will be part of our investigation now that we have the positive test.
At what point, Governor, your reasoning for keeping the media out of your meeting today on coronavirus with state lawmakers?
The briefing that we held today was for legislators. We wanted them to be in a situation where they could ask any question that they wanted and have a candid conversation and address concerns that they may have. So that was just for the benefit of the legislators, that they could have an open conversation and go home and be well equipped to answer any questions that their districts may have.
This is Michael from Kello. I have 2 questions.
Okay, go ahead, Michael.
Wondering, one, if you could clarify which patient was the unknown transmission?
This is Kim Malsom-Risden. We're not able to confirm that at this time, but as that information becomes available, we will make available non-confidential information into the future.
Okay. And my other question was how many tests are left? Yesterday you referenced enough for 800 people. Has that number changed?
No, we still have plenty of testing supplies and kits here in the state of South Dakota. We do have an order in for more, and they will be coming shortly.
At what point will you consider canceling events like the state basketball tournament or other large sporting events, gatherings, that kind of thing?
What we're doing today is that we are offering guidance to individuals that are making decisions about events throughout the state. And we are using that based off of information we're receiving from the federal government task force, from CDC, and then decisions used locally as well with information we're getting from the Department of Health. So we're continuing to advise the South Dakota High School Activities Association on the basketball tournaments that are coming up this weekend. And I would definitely tell the people of South Dakota that if you are elderly, if you're older, if you do have health conditions, I would encourage you to stay home. I think that that would be a wise decision, and we have South Dakota Public Broadcasting that does a great job in covering those games, and we can continue to cheer on the home team.
Are you asking the legislature for any funding or authorizations?
Hi, Jeremy Fugleberg from Forum News Service. Do you have any clarity on both the previous patients and the new ones as far as timing for when they experienced symptoms, when they saw?
I'm going to answer one of the questions that was asked in the room first, and it had to do with, what did you say, Lisa?
Just wondering if you're asking the legislature for any money or authorization.
As you all know, we're in the last 2 days of our budget negotiations and finishing up the legislative session for the year. I'm not putting forward any new requests to them. We know that the Department of Health has been preparing for this for several months. We do know that Congress has passed some supplemental funding, which we expect South Dakota will receive some resources for to meet the need that we do have. We also will continue to be due diligent in making sure that we're using those resources in the best manner going forward. And I think the question on the line was asking about more specifics on those who have tested positive, and I'll let Kim answer that question.
Thank you, Governor. I'd like to defer to Dr. Josh Clayton, who is our state epidemiologist.
Thank you, Governor, and thank you, Secretary. What we know about most of the individuals is that they have developed symptoms in about a week before they presented to healthcare. So it's fairly early on when these individuals are presenting for testing.
Dr. Josh, can you confirm one of the cases is a priest?
No, we're limited what we can share for personal information, obviously, as we go forward, but we'll continue to share all the information that we have and that we can legally do.
These new patients, do we have any indication whether they had interactions with each other or any of the other patients that have already been identified?
From our information, they do not appear to be related as far as interacting with each other.
Have you been in contact with anyone from the federal government regarding how long this is supposed to last?
I have been in constant communication with them. As you know, the Vice President is heading up the federal government response to this virus and pandemic that we're experiencing in the United States and throughout the world. And also, the Department of Health is in constant communication with the CDC with new information going forward. It really, we believe, is unpredictable in how it will go forward, but also there's a lot that we can do to impact how long we deal with this and how many people do become infected. One of the biggest things that we can do to keep people healthy is for people to stay home right now, because a lot of transmission happens inadvertently in crowded areas at big events, and people necessarily don't know that they are carrying the virus when they're at these events and are infecting people. So we would encourage folks just to be safe, make wise decisions. If they don't have to go to a big event, go ahead and stay home. And certainly if you are one of the vulnerable populations that is dealing with health conditions or a little older in life, that would definitely be encouraged by us.